Welcome, everyone. It's about 3:30. So I am going to go ahead and looks like the people logging in is kind of slowed down. So I'm going to go ahead and get started. My name is Stephanie Garys. I'm with the PDG B-5 TA Center. I'm really glad you could join us today. Hope you were able to attend the opening plenary and enjoyed that great conversation. This session is layering services and leveraging funding for maximum resources. So before we go into kind of talk about how the session is going to flow, I want to do a few housekeeping items. So first, would love it if you would change your Zoom name to your first and last name followed by your state, so we kind of know who is here joining us today. And we have the instructions right here. So if you just go click on the three dots, and then you can rename. Okay. And then if you have joined by phone, which it doesn't look like anyone has, so we will skip those instructions. And just so you know, you can use chat function. You can ask questions along the way. You can present out along the ways, and everyone is muted, so we don't have to worry about that. So let me go ahead and kind of give you a rundown of how the session is going to run today. First, we will have the Head Start National Center for Project Management and Fiscal Operations. They're going to be presenting first, and then we will have a transition time, and we'll turn it over to Rhode Island for their presentation. And after that, we have about 10 minutes near the end for question and answers. And, like I said, you can put questions in the chat along the way if you would like. But at the end, you can raise your hand and we can take you off mute and you can ask a question, or again, you can kind of continue that in the chat, and then we'll be closing out the session. So first, I'm going to introduce Arnold Ramirez. He is the fiscal team lead for the Head Start National Center on Program Management and Fiscal Operations. And Arnold is joined today by Natalie Williams and Chandra Davis, who are fiscal specialists on his team. So I'm going to turn it over to you, Arnold.
Thank you, Stephanie, and good afternoon. It's a pleasure being with you. I am calling in from Phoenix. As Stephanie mentioned, I'm the fiscal team lead for the National Center on Program Management and Fiscal Operations. We're one of 4 national centers, Head Start national centers, the others being health, behavioral health and safety, parent, family, and community engagement, and finally, early childhood development, teaching and learning. So we're very happy to be with you. I'm going to turn it over to Chandra, and she'll be giving us a bit of a historical background on the EHSCC partnerships. Then Natalie will come in and give us some definitional information on the 3 funding streams. And then we will jump over to talking about layered funding itself. So Chandra, I'm going to turn it over to you. You can introduce yourself. Thank you.
Thank you, Arnold. And again, my name is Chandra Davis, and I am a fiscal specialist with PMFO, and I am calling in today from Atlanta. So I'm so happy to be here with you guys. And before we get into the background, let's talk about the learning outcomes from our brief conversation today. So our learning outcomes and key takeaways from this session. After completion of this webinar, we hope that the participants can identify how layered funds can support quality services, as well as be able to leverage resources to support the Early Head Start and Child Care Partnerships, which is EHSCC partnerships. So let's talk a little bit about the background of this partnership. How was it started? Right? So, we all know that high quality early learning experience can promote young children's development, as well as to help reduce achievement gaps between children from the low income families and those from affluent ones. So one strategy that the Administration for Children and Families came up with to improve access to high quality care for infants and toddlers was to form partnerships. And these partnerships were to be formed at the point of service delivery in order to build seamless systems of care. So in 2015, ACF awarded 275 Early Head Start expansion and Early Head Start Child Care Partnership grants. So these grants were aimed to basically combine the best of both worlds between early Head Start grantees and regulated child care centers, as well as family child care homes that serve infant and toddlers from low income families. So these partnerships, ACF wanted to ensure that these partnerships can bring together programs, the early Head Start programs, as well as the child care programs, by combining that high quality, comprehensive, relationship-based child development, as well as the family services of EHS with the flexibility of childcare and its responsiveness to the social, cultural, and work support needs of families. And we know that research shows that, high quality early learning experience can promote young children's development, as well as the parents' ability to facilitate lifelong learning for their children. So that was the idea and the premise behind the marrying of early Head Start programs as well as the child care. So that's why those partnerships were formed, and that was the goal of that partnership. So now that we know why it was formed, let's talk about some of these regulations that will guide these early Head Start child care partnerships. So when you are in the partnerships, you want to make sure that you are aware of these regulations. So first you have the Head Start Act, and the Head Start Act is basically the law that governs the Head Start program. It was established the Head Start Act was established in 2007, and this is basically the law as it relates to Head Start. The Head Start program and performance standards are basically the rules that govern how we operate the Head Start program, the Head Start and early Head Start programs. So these are really important as well. Next, you have the uniform administrative requirements, cost principles, and audit requirements for federal grants. And this is from the Office of Management and Budget, OMB. And the uniform guidance is around the fiscal, all the costs and fiscal regulations and rules and laws as it relates to these partnerships. So you want to make sure that you're aware of all three of these, as well as some state rules and regulations. What do we have for the states? We have the Child Care Development Fund. These laws and regulations are really important because they're the federal and state programs that are authorized under the Child Care Development and Block Grant Act. So you want to make sure that you're aware of these, as well as your CCDF state plans and any state laws and regulations, state licensing regulations. So these are the guiding principles, guiding rules, policies, regulations that we should be aware of when operating these partnerships, early Head Start and child care partnerships. So now that we have that, let's turn it over to Natalie to talk to you guys a little bit more about blending.
Thanks, Chandra. And I'm curious, and maybe if folks want to enter it into the chat, are you familiar with the Head Start early child care partnerships? Are you familiar with these in your state? Do you maybe you have one, maybe you're administrating one, but we'd like to know that in the chat box. And then, as always, if you have questions in the chat, you can feel free to just pop those in and we will answer as we can as we go along. But also there is going to be a Q&A at the end of near the end of the session. And when we talk blended funding, and we want to go over some definitions because there's so much lingo that we use when we talk about federal money and federal regulations. So here's blended. Blending of funding means that there's multiple funding streams that are all mixed up to support the total cost of a common goal. And these funding streams lose their individual program specific identities. And that means that there's a less burdensome administrative and that makes it easier to, to use some of these funds.
And Natalie, while you were talking about that, we do have a couple of people who are familiar with EHS CCP. We have Zakia as well as Kristen. They are familiar with the programs.
Excellent, excellent. So, and then again, if you use that chat box, if you have any questions or just want to share something with your colleagues here about your experience. And then we think about braided funding. So braiding is funds from multiple funding streams, and they're used to support the total cost of a common goal. But these are each individual funding stream is going to maintain its program specific identity, and funds from each specific funding source are going to be tracked separately. And so in the fiscal world, we refer to this as cost allocation. And then, so it's going to come into your program, but because the money is it's going to keep its own identity, and we need to actually track it in our financial accounting software separately from other money, because we need to be able to pull reporting and say that this is what we're doing with this money. And we know that this is a little bit more challenging because there's some regulatory things around braided funding. And then with the third one that we're going to talk about, is layered funding. And layering is really when different funds are used to support a common goal, but layers of funding that support core childcare services are supplemented with additional layers of funds that support program, family, or child level services. And funds from each specific funding source, they also have to be tracked separately. So there's a couple of different funding sources, and we have to think about how we start to actually track them. And so is it a blended, a braided, or a layered funding source? And let's look at that first source right now, the layering overview. And Arnold, do you want to walk through this with us? This is an interesting graphic.
Yeah, I'm going to talk to that, but I also want to go back to the blended, braided, and layered funding. We recently did a kind of like a tip sheet for OHS related to these three funding streams. And I remember with the first one, with the blended funding, although cost allocation is not required, Head Start, early Head Start does require cost allocation when you submit these funds. So it may be an easier way from an accounting perspective, but OHS is always going to want these funds to be allocated accordingly. There was also some mention in the chat by one of the staff people about wanting to get additional information. So I want to mention that as we go through these slides, initially PMFO was asked to do the orientations back in 2015, 2016, as these monies were being rolled out to individual partnerships. And we did them in three phases, one related to the fiscal or cost allocation, one related to the agreement, and the legalese related to all those types of things. So please don't take this funding or this fiscal part of it totally out of context from the other two, because it's critically important as you're developing any of these partnerships that you have all three assigned to that, the fiscal piece, the legal piece, the agreement piece as well. So you want to go ahead and move on to that next slide, Natalie. One of the things that we found out as the monies were being released was that a lot of partnership programs were actually doing what we call wraparound at that time. And I know in the municipality that I worked in, we did a wraparound program, and wraparound basically is just having, let's say, 6 hours or less of EHS care plus 4 hours of additional child care. That can be a totally different provider. So it didn't have to be one provider developing all of those services. It was actually broken up so that if programs are looking at making sure that they want to have these partnerships, keep in mind that they're not wraparound services. This is talking about one set of services for these children that is continuous all day long. So as we looked at the next slide, this may be automated. No, the next 3 slides are actually going to be condensed into one slide that we'll focus on. But the child core services are layer 1, and that means whatever the child care subsidy is, that's how you build and start your program from that ground, that foundation itself. So in the agreement phase, you want to make sure what child care subsidy provides. You don't want to leave anything out of that agreement. If the child care subsidy provides more than typical, and we'll look at an example shortly, then please include that in there. The second level is actually the partnership money, and that is for program level enhancements. And it benefits all participants in the program, not only children and families, but it also benefits it also benefits children and families, but it also benefits the providers themselves, the child care providers, because any enhancements to the program are going to be system-wide. They're not just going to be for early Head Start or for child care. The third layer of funding, the individual child care services, really talk about, and this is where cost allocation comes into play. It really talks about those individualized services that are eligible for early Head Start children, but where another fund source has to be provided to cover those types of things. And we'll look at that next example. Go ahead and roll over those slides. So as we're looking for layering services, the child core services, layer 1, are child care funded with subsidies and other child care fees, and funding based on family activity needs. Full day, full year care services funded with partnership funds for those who have temporarily lost subsidy or who need their day year extended. So if a child or a family has lost the subsidy, level 2 program enhancements can be provided to cover that subsidy for that child, for that family. It can't be in perpetuity. It has to be for a certain amount of time. So again, you want to build on the core child care services, and then jump over to the program level enhancements. And when we're talking about the level enhancements, what you're looking at is salary and benefit increases for all staff, not just for early Head Start staff, staff training, expanded hours of the program itself, increased staffing levels. So there's a need for a third person in the classroom. Those monies can help support that. Equipment and supplies, minor facility improvements. And this is where we found out with the partnerships, these need to be spelled out in your agreement between early Head Start and the partnerships. What we did find out with some of the partnerships that didn't work out, that didn't survive, 1, 2, or 3 years, even though facility improvements were made, sometimes the grantee, the recipient, Head Start recipient, did not make that clear enough in the agreement as to what would happen with those facility enhancements. So that needs to really be spelled out, but those funds can be used for facility enhancements. Health, mental health, and nutrition services, parent trainings, screenings and assessments benefiting the curriculum implementation. So that means screenings and assessments that benefit the entire classroom can be included in the program level enhancements. No cost incidental expenses can also be included in those types of things. So I'm wondering if there's any questions in the chat that we need to address during the core services and the program level enhancements.
I don't see any right now, but we do see some, like Nebraska says that they have a public and privately funded 6-pence childcare partnership that were modeled after the EHSCC partnerships, okay, and intentionally partners with family childcare home providers. So that's good to know. They're using some of the resources and using it as a model. And I had one thing that highlighted, it sounded like you were saying, Arnold, that the childcare subsidy is really an essential foundational layer, right, of the child care partnership. And that even though some of your children may be qualified as early Head Start children, all the children in the program are going to actually benefit from this services. Is that what I was hearing?
For the core child care services, when you're developing that agreement between the recipient, the early Head Start recipient, and the child care provider, you want to make sure that you understand and know what's covered under core child care services, because we have found out that in some instances, core child care services are actually cover some of the level enhancements. So those things need to be kind of ironed out so that the program level enhancements can be even leveraged more. So that's part of the agreement, but basically, yes, Natalie.
Excellent. So
the third layer of this, let me go back to that previous slide.
Sorry.
The third layer is level 3. This is where cost allocation actually takes place. So early Head Start children, eligible children, are given individual screenings and assessments, not necessarily for the curriculum, referrals to outside agencies, family services workers conduct home visits, teacher home visits, infant formula and diapers. All of those are covered under early Head Start. So if those types of services are not covered under core child care services in this level 3, then what has to happen is that the child care provider must look for external funding to make sure that all of the children are receiving these types of services. But these program level enhancements, the early Head Start child care partnership funds, cannot be used for individual child care services. One of the things that we found out early on with the partnerships also is this whole notion of the in-kind or non-federal match. That was creating some problems for childcare providers because that's not something that they're typically familiar with or aware of or implement in their particular programs. Excuse me, early on, the Office of Head Start said this should not be an obstacle for making sure that the partnerships are successful. And in order to be successful, it has to be a true partnership. The grantee and the child care provider must come in together at the same level, offering these types of services. And I'm giving that information simply because those were things that needed to be ironed out. Surprisingly, both regional offices and early child care or ACF offices, CCDF offices, were not familiar with the information memorandum came out, and in some cases did not approve of the plans that were being submitted. I know that Chandra previously worked from Region 4, and she saw some of these partnerships. So there was misunderstanding early on about how to implement these types of programs. Just want to make sure that those have been worked out. There still may be some out there, but there's a question from Kristen Lang. Do you have a sense of where the additional funding for individual
child
comes
services
from?
typically comes from?
Well, you know, what we found out, either foundational money or something that the child care provider board or itself may be able to come up with. We just know that the grantee or the Head Start recipient would request this of the partner. Chandra, do you have any experience in this in terms of what happened or what the recommendations were for external funding?
I don't, because, at that foundational level in the beginning, it was strictly federal funding, that was given to the programs for, to start these partnerships. I do know that, they all have their community resources that they, definitely use and reach out to whenever possible. But, if aside from state funding, that they would receive in addition to the federal funding for the EHS, CCP, those are really, the main sources that I would see in Region 4 that they would use.
But that's really a good question, because we did find out that that created some issues, some problems for the partnerships, where the partnership agency, if the grantee or the recipient ask them to generate some non-federal match, it was
Right.
problematic. But
Mhm.
those things I think have been ironed out. Natalie, if you go to the next slide, it's really basically the same slides, talking about the child core services that we mentioned, layer one. Head Start or early Head Start childcare funds cannot be used to supplant and replace child care funds. So again, if if core child care services provide some of the program level enhancements in layers two, that needs to be noted so that you can leverage more of the funds. But the level two, again, is really for those level enhancements that benefit the provider, that benefit children and families, regardless of whether they're early Head Start eligible or not. And that's where you really want to focus on and leverage those particular funds. Again, individual child care services or individual services in layer three is where cost allocation is required. And
And
that's where
Arnold,
you have to look for your outside external sources. Yes,
and
ma'am.
Arnold, Stacy is making a great point with a question that she's thinking about the COVID-19 relief funding opportunities that were made available after the initial development of EHS CCP model. And not to muddy the waters, but has impacted the core child care services or layer one. Is this something that needs to be thought about right now?
Absolutely. If there's any impact to the core services that can be moved to program level two enhancements, that's totally allowable. But you have to know what those core services are in order to, if they're not there, then yes, they can be moved to level two. The cost allocation part of it, if it is federal funding, that cannot be used as a match source, another federal funding source. So again, it's usually foundational money. However, that can can be generated not using federal resources, including the partnerships. I think there was another question also.
Yeah, another question about how we're rolling out the same strategy for children with disabilities under IDEA funding for both Head Start and childcare. Is that part of layer three as well?
Any individualized services, yes, would be part of layer three. If they're eligible, EHS eligible, and they would receive those services. Any of those individualized services would have to be cost allocated and generated elsewhere.
These are great questions. And do you want to share a little bit about the layering services and costs?
Well, I think we've talked about those, Natalie. I'm looking at the time element, and I know we wanted to take them through the ECLKC, but and we're going to mention the cost estimation tool. There is a tool that we will at least partially look at that helps EHS CC partnerships develop the actual cost of operating this type of a program. Let me go back again and say that OHS wants these programs to be successful. They don't want to put any heavy burden or unnecessary burden, either through non-federal match initially, or develop it. And they don't want programs. They don't want child care programs to lose money. So they're really trying to come to these services where it's a win-win for both the EHS recipient as well as the child care partnership. We're going to jump over to ECLKC, where Chandra and Natalie will share the resources that you can find on the ECLKC website.
So, and I'm just going to drop this website also in the chat, and we can just explore. So here we get to the Head Start ECLKC, the Early Childhood Learning and Knowledge Center. And I got here going through topics just so that you're aware. And then you'll find all information on early childcare partnerships under local early childcare partnerships. So if you lose the link, but I think there it is. And then we have, when you look at early childcare partnerships, we'll see some resources here, foundations for fostering childcare partners in strategies, and the cost estimation tool here. And we'll take a look. And so here we see this whole page on cost allocation tour, cost estimation tour, sorry. Getting more jumbled, the estimation tool. And it's going to take you, there's actually an orientation webinar. And then when you look at fundings and payments, and we can look at this PDF. And are you seeing that PDF also?
Yes.
So under fundings and payments, it actually is going to kind of explore the kinds of funding sources that we were talking about, and the methods of payment, and what those layers, again, core childcare service, the program level, and the individual child service level. And then we have, let me see, this. And this is just this is some helpful tips for using the cost estimation tool. And then we have other resources in here about financing and budgeting for early childhood facilities. There's an entire guidebook along here, and then provider cost of quality calculator. So it actually helps you, it actually takes you in here, and you would have to create a username, but it'll actually help support you building, a budget and finding quality childcare, what that expense is. Anything, Chandra, you would like me to click through?
Can we click on the actual cost estimation tool? Is that here? Purpose to show.
There we go. Yes, we have it. And so here is the actual tool. And you can see that it's a great handbook. It's tips for using the tool, and it will go through, and you can add in rates. And is there anything specific, Chandra, that you were looking at?
No, I just wanted to show them that actual tool to help them estimate the cost. I think it's really helpful, in establishing these partnerships when you have them to, this is one of the key resources. This is the actual text version of the tool. So, that link that you showed to that main page for the early child care partnerships is just have a plethora of resources, which includes this cost estimation tool. And it's one of the main ones. I think it's really useful.
And I just dropped that tool in the chat, and I know we're a couple of minutes from the ending, but I did, Arnold, should I just take a look at that other resource? It's not a Head Start resource.
The Mathematica one?
Yeah, the Mathematica.
I think we can look at that as well.
So here, let me see, let me go all the way back to the beginning.
And the purpose for the cost estimation tool is to help really develop a repayment method so that early child care partnership can really maximize and leverage resources. Again, it's not intended for child care programs to lose money. It's not intended for them to make money either. So it really is to balance those two things out and to leverage both resources between early Head Starts and childcare. And the ECLKC is really a great tool if you haven't previously been, gone through it, not only for the partnerships, but for a lot of what PMFO does for facilities and everything.
And so in Mathematica, and I'll drop the link in here as soon as I get back to it, but there's a whole cost estimation tool, and it helps you actually walk through and go through actually the funding and talk about the and the cost and everything like that. So I will be popping that into the chat, and we certainly are. Oh, thank you, Chandra. She did it right away. So here it is. So it starts on this page. Are you seeing it now?
Yes.
So it's going to start on this page. And when you click start, you're actually going to say what you want to do. So you actually want to look at the definitions. It's going to give you the same definitions that we shared with you and the process, but you can actually continue and then actually go back to the guiding questions. And the guiding questions, you're going to say, what do you want to learn more about? Would you? Yes, obviously, we would like to learn more. And then I'm just going to click all three. as a yes here. What is your goal? Increase quality, program quality. We all want to do that. Increase access to ECE, increase access to comprehensive child and family services. And then it's going to continue to give you resources. And it's actually going to help you start building a plan to identify funding streams and doing all of this. So I really think that this is a new tool. I think it's got a lot of innovation in it. It's hot linked to all the possible resources that we can imagine in ECE, especially supporting these partnerships. It talks about financing. So there's really a lot of resources that you want to be able to use in here. And so with that, I just want to, I think we're at this point, we're turning it over to
Stephanie, we're turning it back over to Stephanie.
Back over to Stephanie for introduction of our Rhode Island partners.
Thank you.
Sorry, I was on mute. So, thank you. That was a great presentation. That was a lot of wonderful information. So we're going to go ahead now and turn it over to Rhode Island. So I want to introduce the Rhode Island team. We have Kayla Rosen, who is the Director of Early Childhood Strategy in the Rhode Island Governor's Office, and Zoe McGrath, who is the Early Learning Education Specialist at the Rhode Island Department of Education, and Hannah Hansen, who is a Child Care Administrator at the Rhode Island Department of Human Services. Turn it over to you now.
Great, thank you so much. And we are honored to follow the other team, and really these two presentations are very connected because we're going to talk through how we are braiding and layering funds in the pre-K space, which in the state of Rhode Island right now is really focused on 4-year-olds, although we do of course have a goal to get to 3-year-olds as well. So if we go to the next slide, today we're going to talk through how we are expanding pre-K in Rhode Island using kind of strengthening the entire birth through 5 system by leveraging different funding streams and working across agencies to make that happen. So I'm going to start off by talking about how did we get there in terms of leveraging many funding streams and what has the result been. Then I'm going to turn it over to my colleagues from the Department of Education and Department of Human Services to talk about the nitty-gritty behind how we're actually doing that and what it looks like. And then we'll talk about some of the successes and challenges we've had from working together and what we found in these pilots over the last year. And then we'll open up for questions because we'd love to just hear from you and talk through what's worked and what's been a challenge on our end. So going to the next slide. Thankfully, under the initial PDG grant, our state came together to develop a comprehensive early childhood care and education strategic plan that covers our health, education, and human services agencies. And our plan is founded on 5 core objectives, the first 3 of which are really focused on the system itself and what it should be doing, and then supported by 2 goals on funding and data. One of our key objectives, not the only one, but a key one, is that we want to have universal pre-K for 4-year-olds in Rhode Island. And that for us is 7,000 seats because we have about 10,000 kids in every birth cohort, which I imagine is really different than some other folks on the call. So for us, that's 7,000 seats. And when we say we want pre-K, we mean full day, full school year, high quality pre-K. When we developed this plan, in I think 2019, 2020, we had about 1,800 seats. And so for us, the challenge is how do we continue to make progress, but even faster and in a way that continues to strengthen the birth through 5 system for all kids. So going on to the next slide. Want to talk through how we thought about the process. How do we actually get there of saying, okay, we have 1,800 or so seats. How are we getting to the next step? So the first thing we did is using that structure of the strategic plan where all of our state agency leaders had come together and agreed on those goals. And the governor had highlighted that those were goals. We came together as a staff team in the agencies, the people who actually kind of lead the programs, do the work on a day-to-day basis to think about what were the creative opportunities for how to expand. To date, we've been doing it by opening an entire classroom and funding that entire classroom at 100%. How could we do that in a way that was more cost effective from a state perspective, reached more kids more quickly, and really provided families choice? So we came together to talk through what that would look like. And we had a lot of different ideas. And then we were able to find, go back a slide, we were able to find some funding to allow us to continue to expand. And we, in this case, leveraged additional PDG dollars using kind of the opportunity between year 1 and year 2 to put more money into direct services or the subawards. And we used governor's education, emergency education relief funds, the GEAR funds, to allow us to have some more funding. With that, we're able to bring it to our governance team, which is our state agency leadership, for a decision on continuing to invest in pre-K, which they signed off on, and on the pilot new models that my teammates are going to go through. From there, we presented to stakeholders in the community through several public sessions, at the Head Start meetings, et cetera, to share kind of the new opportunity for how people could apply for funding. We put out a grant application, received applications, had an interagency work team actually go through those to select providers. And then we actually began serving kids this September. So going to the next slide, just to pull back the curtain a little bit, this is our actual team work charter to say, how are we going to get this done where we expand the number of seats? So as you can see, what we do is we talk about our impact goal. What is it we're actually trying to do? Why is this the moment to do this? What's the opportunity statement? Who's in charge? Who's on the team? And what are we actually trying to do? And then across the bottom, you can see our activity timeline. So this was a tool that we were able to use to communicate to leadership across the state to say, what is this team doing? Which gave us the kind of, I don't want to say permission, but kind of the sign off from all leaders for this team to come together and work together in an interagency way to achieve our goals. So going to the next slide, I just want to say, like, this is our progress year over year. And the bar in red is what we were able to do over this last year in terms of expansion, where we went from 1,800 seats to over 2,300 seats in pre-K by developing new models that really braided and layered funds across our agencies. So we're happy to say that we opened 516 new seats this year during the pandemic, so more young kids can have access to the highest quality for free in our state. So with that, I'll turn it over to, Zoe to talk through what exactly those models were and how they worked.
Hi, everybody. So as Kayla talked about our RI pre-K, I'm just going to run through a few just of our hallmarks as we were looking to expand our pre-K for the 21-22 school year. We really wanted to make sure that we were preserving our mixed delivery system with our child care programs, our Head Starts, and our local school departments, while preserving our high quality hallmarks. And so we just listed them out a little bit. For Rhode Island, pre-K is serving all 4-year-old children, achieving comprehensive early childhood education, which is a certification that is given by the Department of Education. All of our classrooms at minimum have a bachelor level teacher. Our pre-K classrooms run for a full 6 hours, 180 days a year. They all use a high quality RIDE endorsed curriculum. All pre-K classrooms, from the classroom staff to administration, participate in professional development and technical assistance activities, and they all participate in RIDE monitoring, which leads to the comprehensive early childhood certification if they meet all of those high benchmarks. So while maintaining all of those hallmarks, we looked at what our expansion criteria is, and it was to meet high quality standards regardless of the mixed delivery system, to continue to invest in our mixed delivery system, to make sure that all seats are completely free for families within the RI pre-K, and to hopefully strengthen the 0 to 5 system overall as we continue with our expansion. Slide, please. Thank you. So as Kayla mentioned, we talked a little bit about the models that we used for funding. And so our traditional model that we've used is basically a grant for classroom-based awards through community-based organizations, local educations, and our Head Starts. And while that helped us build our pre-K system. It's not very sustainable because it requires significant general revenue investment. So some of the descriptions of that are for the models to provide a classroom grant to qualify programs based on an RFP process. So all of our models, even our new pilot ones, have that application process. Programs have to have a full classroom. They can't displace children. So in a traditional model for a full classroom of funding, if you had a few children who were graduating to go to kindergarten, but you had 6 or 7 children that were staying in, that classroom couldn't have applied to become an RA pre-K classroom because those children wouldn't have a place to go. And for our RA pre-K classrooms, all children are selected through a lottery process, which happens through the spring into the summer, and then children are enrolled in September. And as I mentioned before, continually monitored by the Department of Ed and our PDTA center. So some of the challenges with that, as we've already talked about, are not being able to displace children. So if you don't have an empty classroom under the traditional model, you can't apply. And that model was completely funded by general revenue and some federal funds, which as conveniently says, that are not recurring here all the time. So not always accessible to us. So then there's just a little breakdown of what a traditional classroom would look like. It's about $202,000 with an average cost of $11,200 with a breakdown sort of what that sample classroom budget would look like. Next slide, Meg. Thank you. So as we continue to have these conversations about what expansion look like, we sort of went out to our field. We wanted to make sure we had some feedback from our providers. We wanted to talk about some of the challenges and mitigate the barriers. So some of the feedback that we got was about space constraints. Rhode Island is pretty small and pretty densely packed. So historically, programs that needed to have an empty classroom and couldn't displace children wouldn't be able to apply. And there are not a lot of new spaces for programs to expand into. And also for the retention of families. So you may have had a child who you enrolled in a child care program as an infant or a toddler, and they've been there through preschool, but then you want to get your child into pre-K because it's free and it's high quality and you've heard the great things about it. That means that you enter the lottery, but you have to leave that program. And so one of the things we really wanted to do was to minimize transitions for families, really let families have some stability with their child care, to support the teachers, to support the kids. And so part of our model has to do with making sure that children can matriculate within their own programs. And then some general feedback was just that community-based providers really wanted supports around quality investments and quality initiatives so that we could figure out how the money that we were bringing into those programs could really support not just the pre-K, but the overall program quality. And for Head Starts, one of the things that was challenging for them was whether or not they were at a full duration school day or a school year. And so we also took into consideration how we could support Head Start programs with an expansion for their school day or school year. Thanks, Meg. So these are our models. We have 4 models. 3 of them are pilot models for this year. 2 are models that we've previously used. And so what we have very fancily called them as model 1, 2, 3, and 4. So just very quickly, model 1 is our traditional funding. Again, you can see it's for community childcare, Head Starts, or public schools. And that is empty classroom. You apply for grant funding. We provide funding for the entire classroom. It's 18 to 24-year-olds. All of those children come from the lottery. Families submit their kids into the lottery, and then we pull the lottery. Model 2 is our pilot program for Head Start expansion. And so that is only eligible for Head Start agencies. And that is to bring classrooms that were from 4 hours up to 6 hours, or if classrooms were at 170 days, bringing them up to 180 days. So there were quality dollars that were awarded to those programs to be able to maintain their current Head Start seats, but expand their days and their years. Model 3 is Head Start braiding, which I wish that I had had that very cool little mathematic tool before we were talking about braiding and blending and all of layering, because that would have been super helpful. But model 3 for Head Start braiding is Head Start programs who have Head Start children in a classroom. Those children stay there. Those seats are safe and secure by federal dollars with Head Start. And then other other children come in through the lottery. And so we are braiding the funding from federal Head Starts and then our state and federal RI pre-K funds. Model 4 is the model we're going to spend a little bit more time talking about, which is our CCAP supplemental model, which is child care subsidy dollars that are available to children and families, which will allow children to remain in their classrooms if that classroom becomes a pre-K awarded classroom. And Hannah's going to bring us a little bit through that. And then Model 5 is our LEA General Education Classroom program, which is basically taking special ed integrated preschool classrooms and trying to transform them into full day gen ed classrooms with some quality initiatives. So all of the partners and providers who were able to participate, we thought a lot about making sure that we did not reduce any of the access within our Head Start or community care or our school department classrooms, making sure that we were really aware of what was happening in the market, making sure that all of those classrooms have to meet all of the benchmarks and the hallmarks of RI pre-K regardless of their setting. And all of those models were still awarded through a competitive application process. Thanks, Meg. I believe I am turning this over to Hannah now. This is Hannah Hansen from Rhode Island DHS.
Thanks, Zoe. Hi, everybody. Excited to be here and get to talk about this work in a little bit more detail with you all. As Zoe alluded to, we're going to go into a little bit more detail around Model 4 and what that's looked like this year. It was a new model that was piloted in the 2021-22 school year. And as she mentioned, it leverages the existing child care assistance program known as CCAP to offset the GR cost per child using CCDF dollars. And it was also particularly developed to mitigate the barriers that were also mentioned in an earlier slide, both shared by providers and families based on the traditional UPK model. So specifically for providers, space constraints, for those that didn't have an unused space where they could start a new classroom, they are able to matriculate an existing classroom under this model. And then in terms of families, it helps mitigate some of those barriers around family retention or family choice. So the next few slides will look at this in more detail. So as I said, Model 4 leverages CCAP funding to be the first dollar in for pre-K classrooms by using that subsidy cost that already exists. And then the Department of Education, RIDE, where Zoe is, they cover the remaining classroom costs. So for children that are 4 years old that are already participating in CCAP or eligible to matriculate into CCAP prior to the start of the year and already attending a Rhode Island pre-K provider, they can choose to stay at the program that they've potentially been in since they were an infant or toddler to be a part of then the universal pre-K program in Rhode Island, rather than entering the lottery and potentially being displaced into another program through that lottery process. So this is the first model that sort of provided that family choice, family access in that way. Then additionally, programs, so in terms of like first dollar in, programs submit their CCAP reimbursement to the Department of Human Services over where I am, as they typically would. So the program, there's no change to our child care subsidy program as it existed previously. But then what would happen is the differential of the cost per student is on top of what already exists for the CCDF dollar is then charged to RIDE, the Department of Education, who then also covers the cost of parent copays. As I talked about a little bit already, the model provides increased choice for families by allowing the children to remain enrolled with their current provider, rather than potentially like ending up somewhere else through the lottery process, which also obviously reduces an additional educational transition that the child would be faced with and the family would be faced with, and the cost of that copay is covered. Programs benefit from this model in a variety of ways as well. They receive additional funds to support increasing the quality of the UPK classroom. Thank you for advancing, Meg. Whereas they would typically fund the classroom using only the CCDF dollars. So you can see there from the chart, you can look at what in red would be the typical cost that a program receives for that CCAP classroom or a typical preschool classroom before converting to the Model 4 UPK classroom. But with the Model 4, they get that additional quality investment layered on top. And again, they're able to retain children and families up until kinder instead of losing them to the lottery. The other piece to mention that I think was actually on the previous slide, but you can kind of see it or envision it here with this chart, is also in our state, as our CCAP rates are set in statute, but as CCAP rates increase over time, that also would then defer the additional GR cost as the CCAP rates go up. So there's an additional benefit or potential cost savings to GR as and motivation to increase those childcare rates. Other things laid out here that we didn't already talk about is that additional dollar that's laid on top by RIDE covers quality supports, including curriculum and other materials. It also would offer the higher teacher salaries that would fund those classrooms. And those Model 4 programs are committing to achieving high quality classrooms through RIDE's monitoring as well.
Hannah, and you have a question in the chat.
Yeah, I was just going to take a look at that. So there was a question about Model 4 meeting all pre-K requirements. So all of our RI pre-K classrooms have to meet the exact same benchmarks. There are a few differences as far as community-based classrooms and Head Start classrooms must have a bachelor degree teacher. All of our school department pre-K classrooms have to have a certified teacher. Classrooms can be anywhere between 18 or 20. Again, that's going to depend on licensing and how much space they have. And sorry, I just clicked off. Let's see. Oh, that's a different question. Oh, Kayla. Kayla's answering. Kayla's writing a writing response while I'm answering the question. I was like, wait, that's not the answer. And then for the CCAP child per classroom. So what we did was we asked all of the programs that submitted applications for Model 4 to give us sort of an estimate based on their budget about how many children they were staying. So kids that had moved into that classroom, children that were going to be staying and not going off to kindergarten or moving into another program. And then right before we pulled the lottery, we went back and confirmed those seats with them to make sure that the numbers hadn't changed, which of course they had, and we knew that they were going to. In our head, we knew that this was not going to financially make sense unless we had about 5 children who were receiving subsidy. And the ultimate was somewhere around 9. That made the breakdown and the funding make a little bit more sense if we had 9 children who were getting CCAP first and then 9 children who were coming in from the lottery.
There was a second question that came in. I don't know if you saw that one, Zoe, from Kristen. I think we're actually going to talk a little bit more about this in a couple slides when we go to sort of like lessons learned. But I would just say, I think Zoe just mentioned this to her point, like, yes, there was definitely changes in budget versus what was projected, what was actual. And we can talk a little bit more about the CCAP eligibility piece when we go to lessons learned. Some of this is still lessons learned in the process because we're only in month 2.
Still learning. It's only October.
But we're going to talk more about all this in just a slide or 2.
Okay, so this is just sort of a breakdown of where we are. As Kayla mentioned, we opened and brought in over 500 new seats during COVID last year. So we were really not sure what our response was going to be to this RFP, and especially as we were introducing new models and doing all of this through Zoom, it was a whole new world. So we did get 49 applications, which broke down into 60 classrooms in 21 communities in Rhode Island, which was 1,124 seats. Also, you can see obviously the service delivery model for Model 1 through 2, 3, 4, and 5, the number of seats that were requested by the applications that came in, a breakdown of what the average cost is. And so if you'll remember back to those few slides ago, it was $11,200 per child with a traditional fully funded classroom. So this obviously shows that there is a cost savings, which makes this much more sustainable as we are looking into these models. And then a breakdown by setting as far as childcare centers, our local education organizations, and our Head Start agencies. And again, just another breakdown. We now have 127 classrooms, 2,364 seats. We are at 33.7% of our universal pre-K goal of 7,000. And we currently have 34 pre-Ks in our local school districts, 51 pre-Ks in our Head Start organizations, and 42 pre-Ks in our RI pre-K center-based programs. And I have been involved with RI pre-K since its inception in 2007, when we had, I want to say that there was maybe 48 kids in the whole thing. We were a very boutique little project. So we've come a long way, and it's been exciting to see all of the changes that we've made, and the progress and the children that we've been able to support. And now with the new funding models, it's very exciting to see how much more we can grow and continue to sustain that progress. And so I believe now I'm handing it back to Kayla.
Yeah, so just to talk through some of the, what we've learned. So as we said, we're still early in implementation for these pilot service delivery models. This is our first year. It's October. They've been actually implemented for like 6 weeks now, right? So we're learning as we go. And so, some key conditions for success. The first is having really strong relationships at the staff level of the people actually implementing the programs. I think you can get a sense from just this presentation that we all enjoy working well together. We want to be creative, we want to serve the kids, and that's needed because people need to be creative with their funding and think about this as a shared goal that we're trying to do together. It's not for the honor of one agency or one funding stream, it's really for the benefit of the kids. We want to be considering ways that we can, to the question about CCAP eligibility, we want to be thinking about ways we can identify families who are eligible for but not yet enrolled in CCAP to really maximize the use of federal funding. How can we use the lottery process or other processes to engage families in CCAP who might not otherwise know about the program or the opportunity, and also use that as a way to make CCAP, the CCAP process itself, easier and more attractive to families. We want to make clear policies about matriculation for children who do not qualify for CCAP. Right now, the matriculation really is targeted to our kiddos who are utilizing a CCAP voucher. That is not true for the kids who don't have a CCAP voucher, which can get a little confusing, particularly at scale. I think right now we have 5 or 6 classrooms in Model 4. As we think about this being the primary model potentially, how to do that at a systematic level is still an open question. And then we want to, really dedicate resources to technical assistance providers. That's kind of one of our absolute conditions for success is, how do we make sure that everyone's going to maintain that level of quality that Rhode Island Pre-K is known for? So how do we use the existing information, such as our quality rating system, to map existing capacity, to identify the new folks we'd be able to bring in as providers? How do we do the right outreach to providers to highlight the opportunity and the benefit that this is actually going to support your overall program, not detract from the other areas of your program? And we want to support provider estimation of matriculating children with CCAP. So to that same question, it's really hard to know how many kids are going to have matriculate several months later. So people need to be very smart with their budgeting, which requires us to help them get there. In an ideal world, when we're at a universal level, this looks very different because we'll have a strong sense of how many kids are utilizing the CCAP benefit. We'll be able to do this more as a caseload estimating. Right now, we're not there. So how do we do that, program by program in a way that protects the program solvency, protects our cost estimations, so we can really serve the kids? So lots of lessons that we're still taking away. Would be excited, at the end of the school year, I'm sure we'll have learned a lot more, but these really are some of the foundational pieces for success for us moving forward. I think with that kind of wraps up our session. We'd be happy to take any questions. I've already gotten an email or two asking for further materials, so trying to respond to those, but turn it back to Stephanie to take us to our Q&A session.
Okay. Thank you very much. Another great presentation, a lot of great information. So we're actually ahead of schedule. So we have time, but we do have the time for questions and answers. So if you'd like, you could put your question in the chat, or you can come off mute and we can have a face-to-face conversation. You can raise your hand or come off on your video, but you can raise your hand if you have any questions and we can take you off mute. And this would be questions for both teams.
I have a question. I feel like you talked about this being a challenge, but I wasn't sure how specifically you dealt with it. You know, in theory, every 4-year-old's eligible for preschool. I know there's a lottery, so that's probably part of it. But like, if you're dually eligible, obviously, if you're 4, you're dually eligible for, and if you happen to be eligible for Head Start, for childcare subsidies, but those also have and both have sort of enhanced programs, but also maybe not enhanced, but like stricter requirements. How do you balance that? It sounds like you could say, well, I could, get a subsidy, but then I have to, turn in all this paperwork and prove that I'm working, or I could just get a slot, but I guess maybe you're taking a chance with the lottery. So I didn't know if you used some kind of incentive or prioritization so that to kind of overcome that sort of weird dichotomy between like one family doesn't have to jump through hoops, another family does. And I don't know if you want to talk about how that worked.
Yeah, I can start and then would turn over to Zoe and Hannah to add. So just to the example of, a family who's utilizing a CCAP voucher. Everyone is welcome to use the pre-K lottery that Zoe discussed. Right now, pre-K is only in some communities, not all communities. So that's just a note. So if you're in one of the communities, then you can go through the lottery. The benefit right now that we have of continuing to use your CCAP voucher is that if you go into the lottery, you are not guaranteed a spot in the program of your choice. If you're on a CCAP voucher, you could matriculate within the program you're already at, which is a benefit, right? Because then you're reducing the educational transitions, you're already familiar with the teachers, it's kind of where you expect it to be maybe anyway next year for your kid. So that's really the benefit of continuing to utilize the voucher. I should also say a condition for success that I did not mention is that we did pass a year-long continuing eligibility for CCAP kids, regardless of kind of where income goes. Hannah can correct me, but that was required as well to not have the vouchers kind of yanked from kids in the middle of the year. So that would be the benefit as to why you would keep using the CCAP vouchers. It's what enabled you to matriculate in the program. But certainly that is a question about what is the equity and burden on different families to participate in programs based on kind of what they are eligible for, and how do we reduce that burden and make it equitable across the board. I don't know, Zoe and Hannah, if you want to add anything.
Well, I would just add a couple of things. One, programs needed to apply through the RFP. And so they had to apply for this model, and they had to be approved for that. And so, as Kayla said, it's a really small scale right now. It's about 6 classrooms that are working on Model 4. So not all programs are going to apply for that. Programs that did apply for that were encouraged. We spent a lot of time talking to them about how they would present this to their families and how to figure out what families were going to be staying and what families were going to be going. We absolutely had families who had committed to matriculating in a pre-K classroom where they had been, who applied to the lottery to go to a pre-K program in another site within their community and had to do some flip-flopping. And so it's really hard to kind of control that. But what we did do was pad our budgets a little bit to make sure that we could cover the co-pays, because we didn't always know what the co-pays were for the families that were coming in for CCAP. We wanted to make sure CCAP families understood that pre-K was covering the hours of the pre-K day. And so they could still access their CCAP for their before and their after school, as well as their summer and their vacation camps, because pre-K follows a 180-day school year calendar. So there was a lot of sort of behind the scenes work that went into all of that. All that being said, is it's still not systemized. We don't really have a good system at this point yet. We sort of did a lot of like trial and error and see what works. And we're Rhode Island, so we're a little small. We managed to kind of make it work with a lot of sort of conversations and, you know, trying to create some systems sort of on the fly, but it's definitely a work in progress. And I don't know if you have anything else you want to add from the CCAP end. I do know that we've talked a lot about, sorry, Hannah, I asked you and then I cut you off. We've talked a lot about wanting families to utilize their CCAP vouchers. And so Jan, that is one of our sort of challenges. Like as families are coming into the lottery, many of them would qualify for childcare subsidy. And we cannot force them to do that. So they can come into the lottery without that. What we do is we work really hard with the formulas as far as like taking Head Start children and the kids who are eligible for Head Start, those kids go into Head Start seats. Then there's sort of that 185 to 200% poverty level where those kids fall. And there's different ones for where CCAP is. So it's a lot of math. And that's why I said that tool would have been super helpful if we had known that that existed last year when we were talking about all of this. But definitely still has a lot of challenges.
Hi, my name is Amanda. I'm from Kansas, and my question really builds on what you were just talking about there, Zoe. I'm curious if you could talk a little bit more about the support that you provided local programs as they were budgeting and just figuring out, okay, how do we put these different funding sources together to be able to get to a program budget where we're able to pay our staff and report appropriately and do what we need to do.
Yeah. So
especially in an RFP process.
Yeah. So I will say that we've always struggled a little bit with the RFP process, so much so that our PDTA hub, we have asked them to provide some grant writing and some budget professional development so that can help that piece. We spent a lot of time ourselves kind of looking at the numbers and coming up with various scenarios and a lot of Excel spreadsheets, more than I really am comfortable with. But we know these programs, you know, we're small, we're a really tight group community here. And so we know who our programs are. We did not have any new programs apply for Model 4. So I think that that's important to note too. The programs that have applied for Model 4 were current RI pre-K programs who wanted to expand. So they may have, we didn't limit anybody to anything. So you could have a traditional funded classroom and right next door, you could have a child care subsidized classroom. And we do have that in our programs. And so we did some webinars and some orientations when we were working through these models. We brought the models to our early learning council. We shared them statewide to get some feedback. And we just did the best that we could to really make sure that people understood that. And then once they submitted their applications and if we had questions, we had an interview process after where we could go back and say, hey, this didn't quite make sense. You know, you applied for this, but this amount of funding doesn't really make sense this way. We think this might fit better into this model. So we have the luxury of being able to do that because we're a little bit smaller, but it was a lot of boots on the ground to make it work. And as we've said, it's October. So we'll look back in May and June and see how we've done so far with our budgets. But right now it all seems pretty good.
Okay, do we have any more questions? Got a lot of experience on this panel. Okay, so I want to give both teams an opportunity before we head to closing, if there was anything else that you wanted to add for the participants today. And if not, I can just move on into my closing.
Stephanie, I did want to talk about PMFO has a info hotline where usually programs, Head Start, early Head Start programs can call in or email a question. We also get questions from private childcare providers that are looking for partnership opportunities. So we have some staff on board. Tim Adams wasn't able to be with us today. They usually follow up on those types of things, but there's still availability of those types of partnerships out there. We do expect additional funding for that. So yeah, they're a lot stronger than they were 5-6 years ago, just because experience has taught us a lot. So we look forward to continuing our relationship with childcare.
Great, thank you, Arnold. Is the hotline on the eClick website?
I think it is, isn't it? I think it is.
Okay.
It is on there, and it's also contact information is also available on the last page of our slides that have been uploaded to your conference site.
Great. Thank you.
From the Rhode Island side, I would just say that one thing that I'm particularly excited about, despite all of the many challenges that we've talked through, and there are many, is that, should the budget reconciliation plan pass with significant funding for pre-K, we feel good that we have models in place that allow us to expand within the birth to 5 system without displacing our existing network of providers, and that will help stabilize the system overall, as opposed to potentially pushing people out. So that's kind of our hope with this, is that by getting that implemented, getting it going, getting some practice and experience, building up the systems that we need across agencies, we'll be positioned to rapidly take in additional dollars to move this forward. Fingers crossed we actually get the money, but that's something that we're particularly excited about on this end.
I would say the other thing that I'm really excited about is that as we're all from different agencies here in Rhode Island, and we work really well together through cross-agency work. But part of what I'm excited about with these models is that it allows the money to be a little bit more accessible to programs, so that there's this sort of trickle down effect, so that we're not just looking at pre-K classrooms, but we're thinking about, now that some of this money is coming from CCAP and some of this money is coming from here, how can that money then go down to your infant toddler teachers, and how can the curriculum that you're using, because you have to use an endorsed high quality curriculum from RIDE, let's use that for your infants and toddlers and your preschools and not just your pre-K, so that we're really spreading out the quality and hopefully really strengthening that birth through 5 system in Rhode Island.
Great, well, thank you. So I just, I really hope, today that you learned how to identify how layered funds can support quality services, how you can leverage resources to support early Head Start and child care partnerships. And I really hope from Rhode Island, you have seen that those strong state relationships and governance supports support innovative investments, and that states can really leverage multiple funding sources to invest in their mixed delivery systems, which benefits the children, the system, and the programs overall. So, and I am going to share my screen. I have just one other thing I want to share with you. Okay. So there are 2 places, and I need to put these in the chat too. So just 1 second. Okay. Just want you to be aware, just to remind you of the PDG B-5 TA center resources we have. You can browse them by topic, and I want to put this in the chat. I'm sorry, I'm struggling a little bit with the sharing in the chat, so please bear with me. Okay. And then the other resource I wanted to share with you today is the Child Care and Early Education Research Connections. And with the our convening, we really focused on the data systems, equity, finance, governance, social emotional development, special populations and coordination, systems building, coordination and integration. So you can find additional resources at this website as well. And I'm going to pop that in the chat also. So there you go. So you should have all of that. And with that, that is the end of the session today. We really hope you all enjoyed it. And I believe there's evaluations for each session. So you're going to get 10 minutes back in your day, and I really hope you enjoy the rest of the convening. So thank you all very much to our presenters from PMFO and from Rhode Island. We really appreciated your time and your knowledge. And I think you got a lot of kudos in the chat for the great work that both organizations are doing. So thank you, everyone.
Bye, everyone. Thank you.
Thank you.
Okay, thank you.